Hello everyone, it's Schematic Med, and today we're going to talk about selection of initial bronchodilators for stable COPD. The choice of initial bronchodilators for chronic obstructive pulmonary disease or COPD depends on symptoms severity and exacerbation history. We will divide three groups: Group A, Group B, and Group E. Group A, mild COPD. Patients with few symptoms and no exacerbations. They should start with a short-acting bronchodilators, for example SAMA, as needed. SAMA is short-acting muscarinic antagonist. Before moving on, I want to mention that we need to assess these patients using validated instruments such as COPD Assessment Test or CAT or CAT or Standard Dyspnea Scale. If the patient has dyspnea causing slower walking or worse, it means we have higher symptom severity. Now Group B. This is moderate COPD for patients with more symptoms but no exacerbation. Treatment is long-acting bronchodilation, for example LABA and LAMA, LABA plus LAMA. LABA is long-acting beta-2 agonist and LAMA is long-acting muscarinic antagonist. Group A and B, low-risk patients, have 0 or 1 exacerbation per year without hospitalization. Since their condition is more stable, they typically start with a short-acting bronchodilators or long-acting bronchodilators. So outpatient systemic corticosteroids requirements are less than 2 during prior year. And Group E, patients with frequent exacerbations. If a patient has 2 or more exacerbations or one and more hospitalizations, treatment starts with LAMA or LAMA or dual therapy, for example, LABA or LAMA, LABA plus LAMA. Inhaled corticosteroids or ICS are recommended if peripheral blood eosinophilia is more than 300 per cubic millimeters, but please avoid it if recurrent pneumonia is present. Most of the time, patients who are in Group E require outpatient systemic corticosteroids in prior year, 2 and more times. Thank you, bye.